Hello, I'm Dr. Ashkan Langrudi from Stanford University Department of Urology. At this year's AUA meeting, I'm presenting our new research on GLP-1 receptor agonist popular medication used for diabetes and weight loss and their possible impact on sexual health. We analyzed data from hundreds of thousands of patients in a large US insurance database. We found that people taking GLP-1 medication like semaglutide had a slightly increased risk of sexual dysfunction. Specifically, men had a 22% higher chance of erectile dysfunction and 30% increased risk of difficulty reaching orgasms, while women were nearly twice as likely to have trouble achieving orgasm, although these issues were still relatively uncommon overall. Interestingly, when we looked at patients taking another diabetes medication, metformin, we noticed similar patterns, though the risk was somewhat lower. Importantly, we saw that the longer patients used this medication, the higher their risk of sexual problems became. An important question we considered was whether these sexual issues are directly caused by medications or by patients' underlying health conditions, such as obesity or diabetes. Our findings suggest that these health conditions likely play a significant role, although our data didn't directly measure how well patients' blood sugar were controlled on these medications. Since similar problems occurred in patients on both GLP-1 medications and metformin, it seems more likely these issues are related to patients' overall health. While we cannot completely rule out a direct medication's effect, it doesn't appear to be main cause. Another common question is whether sexual function improve after stopping GLP-1 medication. Unfortunately, our study didn't directly assess this, but there have been some individual reports where sexual function improved after stopping the medication, but this isn't conclusive evidence. We'll need more research to better understand that. So, how should we counsel patients starting GLP-1 medication? First, doctors should openly discuss that some patients may experience changes in sexual function, though it's uncommon. Second, emphasize that these medications have important health benefits like better blood sugar control and weight loss that often outweigh these risks. Lastly, encourage patients to talk openly about any sexual health concerns so we can make adjustments if needed and support them fully. In summary, open conversation between patients and healthcare providers about potential sexual side effects are key to making treatment safer and more effective. Thank you so much for your attention.